कच्ची डोरियों 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 से मैनू तू बांध ले, पक्की यारियों 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 होंदे ना फासले। ऐ नाराजगी कागजी सारी तेरी, मेरे सोहणिया सुन ले मेरी दिल दियां गल्लां। करांगे नाल नाल बह के, अख नाल अख नू मिला के दिल दियां गल्लां। करांगे रोज रोज बह के, सच्चियां मोहब्बतां निभा के। सताए मैनू क्यों, दिखाए मैनू क्यों, एवें झूठी मुट्ठी रुस के रुसा के दिल दियां गल्लां। करांगे नाल नाल बह के, अख नाल अख नू मिला के दिल दियां गल्लां। करांगे रोज रोज बह के, सच्चियां मोहब्बतां निभा के।
Hello ladies and gentlemen, boys and girls, we are here at 2 for Joy Studio with another episode, and here we have Professor Dr. Negi, who's recently taken superannuation from Indira Gandhi Medical College. We have Vinod on the vocals who'd be singing for us tonight, and we have Gaurav. Gaurav would be playing guitars, and then we have Bharat. Bharat is also supporting the vocals. We have a small cake cutting ceremony for you, sir. We planned this for you, especially to commemorate your superannuation. Please cut the cake, sir. I would like Dr. Negi to share a little bit of his journey through the years in the field of cardiology and heart attacks, because today's episode will be focused on heart attacks in Himachal.
So thank you so much for giving me this opportunity, and basically I did my education from All India Institute of Medical Sciences, did my MBBS, MD and DM Cardiology. And I completed DM Cardiology in way back in 1989.
Wonderful, sir.
So I joined IGMC in 1990, and at that point of time in IGMC the cardiology was practically not existent. We had only one treadmill machine, small room, and a single room in the treadmill itself I started my journey.
Wonderful, sir.
So over a period of almost I think more than 3 decades, we could establish the Department of Cardiology from scratch to the today
what it is today.
So initial part of my journey was basically mainly focused on establishing the basic facilities which are required for investigation and treatment of patients with heart. So it took almost 7 years for me to start everything what we have today, from the non-invasive like echocardiography to the cath lab, angiography, angioplasty. And after the department was established, then second, the goal which I set for myself was to start the DM training program.
Wonderful, sir.
And here I am very pleased to say that very select medical colleges in country are running this DM training program.
DM Cardiology.
So we could start this in way back in 2011, and every year we take 2 these candidates, and after starting DM training program, the quality of work improved. We started doing the research, and the patient care also improved because of the DM training program.
Right, sir.
And after this, then I set goal for starting some kind of research. So we have been actively involved in various research, our own initiated and multicentric studies, coordinated by very prestigious institutions like Imperial College of London,
right, sir,
and Public Health Research Institution, McMaster University of Canada, and various multicentric study funded by ICMR.
Right, sir.
So we did quite a bit of public health research. So
Right.
I'm going to elaborate on the outcomes subsequently. And after this, my interest was basically in public health, because I did a fellowship in public health leadership from the Rollins School of Public Health, Emory University, Atlanta.
Right, sir.
And based on whatever I could learn, I tried to implement it in our state.
You have not chosen the greener pastures that are available to so many doctors, and you've not traveled abroad and settled in US or Australia or New Zealand. You chose Himachal as a state. What was the feeling that you got, and what was the reason why you chose Himachal?
Somehow after doing my graduation, always it was in my mind that I'll go back and serve HP.
The people of Himachal.
Right. So probably that was the main driving force, and it was probably destiny for me.
Ji.
And after joining the IGMC, because of that passion to do something for the state, with the support of everybody in the institution as well as at the government level, we could establish, which I told you, in a matter of 7 years.
Right.
So the idea was basically, somehow it was in my mind that I will go back and serve my people in Himachal.
So thousands of patients, sir, you must have treated over the years. How many of such patients come to you and on an annual basis, sir, in Himachal?
I would say the daily I see approximately 100 patients, sometime more, sometime less. And in a month you can say 2,000 patients. In a year maybe 30,000 patients. Now you can calculate in last 3.5 decades.
Right.
So must have seen quite a number of patients, right?
There's a perception in the society, and there's a thing that people in Himachal are more healthy and more free from diseases compared to the rest of the country because of the air that we breathe and the nature that is there. Would you like to throw some light on this particular aspect, sir?
I agree with you. There's a general perception that people from hill areas, because of their increasing physical activity, obesity is not as much as what you see in the bigger cities in the country. And maybe the air pollution definitely is less than what we see in
Delhi
like,
and
right,
in
these
metros.
days,
Yeah.
right. So, but still we do see patients of heart attack in Himachal Pradesh also. I think if I look back 30 years back when I joined, at that point of time we used to hardly see patients with heart attack.
Right, sir.
You know, almost 6 months I still remember that I did not come across any patient who required admission.
Oh, wonderful, sir.
Right. Today we see every day almost 5-6 patients are getting admitted with heart attack.
Every day.
Every day. And the more concerning thing is that younger patients, we have seen people aged 20 years also having heart attack. So this is something very alarming trend, and which has increased in last almost, I would say, 10 years or so.
Yes.
Maybe because of improvement in the socio-economic status, and the lifestyle has changed. The usual physical activity which used to be very common, people used to walk long distances.
Yes.
Today people do not prefer to walk, they take the automobile
Yes.
mode of transportation.
Right.
Even in the rural areas also, people wait for buses, public transportation,
Right.
their own vehicles, and we have networking of these roads connected to all villages. Previously people used to cover on foot. So I think there has been sea change in the the general lifestyle of the people, as well as I would say the dietary habits have also changed. I would say in the rural perspective, the people used to grow the traditional indigenous cereals,
Organic food.
and diverse the cereals.
Right.
Today these have basically vanished because people started cultivating these cash
food.
crops.
Acha.
Cash crops like apples in our, at least
Right,
Shimla
right,
district,
right,
etc.
right, sir.
And lots of pesticides, and the traditional foods have vanished. So the quality of food, the chemicals which we are ingesting, physical inactivity, probably tobacco and drug addictions, which is very rampant
yes.
today
We did
in
a
youngsters.
podcast on drug
Right.
addiction just
So
before
I
this.
think these are many, the issues which are unique to our state maybe, which are leading to increased, prevalence of the heart diseases, which
Right.
was not there earlier, as I was telling you.
Right. Compared to other regions in India and even globally, what is the incidence of heart disease in Himachal?
To be specific, if you talk about the heart attack, which we are discussing today,
Right.
We really do not have any very reliable estimates of the incidence of heart attack at the country level.
My goodness.
And I think IR is the only state where, because we had this program on care of heart attack patients in Shimla district for last almost more than 5 years.
Right, sir.
So we can reasonably are sure that whatever number of patients which we are seeing in the district, particular geographical area, we are capturing practically more than 90% of the patients. So based on those figures, I would say that in Himachal Pradesh, probably I think out of 1 lakh population, 70 people get heart attack every year.
Oh my God.
And Himachal Pradesh, if you talk about, you translate into the whole state, approximately I would say around 4,000 people get heart attack every year.
4,000.
Yeah.
That's
So
a very
we
significant
have
number.
no data in other states like this,
Oh.
because there is no study like this.
Oh.
So, but I'm sure the people living in the metropolitan cities, cities which are polluted, obesity prevalent,
Right.
figures are likely to be more than this. But
Right.
Himachal also, the trends shows that the heart attack is becoming common and affecting younger people. And equally important is that it is equally common in rural population, as general perception that people living in urban population, because of increasing physical inactivity, they taking unhealthy foods in the city, the cities, urban areas, the problem of heart disease are likely to be more. But what we have seen in our study, that heart attack is equally common in rural as well as in the urban population. 90% of our patients of heart attack in Shimla district were from the rural areas. If you see the geographical, demographic distribution of the population
Right,
in the
sir.
district, around 90% people live in the rural areas.
So you would also have district-wise data, perhaps.
We have started collecting data from last 1 year only, but I think still the data is not complete.
So to a little, I have read it somewhere before that Hamirpur per se is a particular area where heart attacks, the incidence is higher compared to the state.
Right. Few years back, at least I think 10 years ago, we had started the same heart failure registry in whole of the state,
Right, sir.
which was basically funded by NHM, which went on for almost 3-4 years. Based on that data, we analyzed that district Hamirpur had the maximum number of patients of heart attack.
Heart attack.
But that could be basically because of other reasons also. Maybe the data from other districts were not captured.
Not captured.
Because that time we
totally.
did not have this IT tool.
Right.
WhatsApp today is very, very handy.
Very right.
We have made a groups, patients getting admitted in any district, any hospitals, they share in the group, so we get the data.
Right.
But that time it used to be purely hard copy based data.
Right.
So
sir.
it depends upon how carefully the patients were screened, detected and reported. Under reporting could be one of the reasons. Second reasons could be they are genuinely, maybe in Hamirpur, the number of patients with heart attacks are more than the other districts. But that needs more future studies.
Ladies and gentlemen, here we have Dr. P.C. Negi, who's been informing and guiding us through the heart attack in Himachal program, and we've prepared a small song for him for his contribution to the state of Himachal Pradesh, and Vinod and Bharat are going to do the honors now.
ओ माई मेरी क्या फिक्र तुझे क्यों आंख से दरिया बहता तू कहती थी तेरा चांद हूँ मैं और चांद हमेशा रहता है तेरी मिट्टी में मिल जावा गुल बन के मैं खिल जावा इतनी सी है दिल की आरज़ू तेरी नदियों में बह जावा तेरे फसलों में लहरावा इतनी सी है दिल की आरज़ू
When we look at the why behind these numbers that you've been mentioning about the incidence of heart disease, what are the causes and the risk factors that can help a person, a common man, understand how can he avoid heart attack and how can he live a healthy life?
It's a very, very important question you have asked. Basically, if we know what causes heart attack, then we can prevent it. So based on the studies, what we know today, that people who are obese, people who have high blood pressure, high cholesterol, and people who smoke tobacco, those who are physically inactive, and people who consume less of vegetable and fruits, consume more unhealthy foods like sugar and refined grain-based fast foods. So these are the people who are at a high risk. Apart from these, the factors which we acquire through lifestyle, those who have a family history of heart attack, for example, if the parents had heart attack at the young age, their children are specifically at a high risk of developing heart attack.
Right.
So these are some of the important factors and which are preventable. So therefore, if we understand them, take precautions to control them, we can certainly decrease the number which I told you, and the trends which we are seeing, the rising trends, can be decreased.
Sure, sir. Sure, sir. So are there any specific risk factors that can exacerbate or increase the incidence, apart from the ones that you've already mentioned, like smoking and...
Right. So one are basically lifestyle related factors which we have discussed. The second could be the environmental pollution also plays a very important role. So the environmental pollution, be it indoor pollutions, like for example biofuel mass related to the smoke, which are common in rural areas, specifically in the winters, and which of course is, I think, has decreased over years because of increasing use of the other means of housewarming, but previously it used to be a major cause. So the environmental pollution, both indoor and outdoor, and genetic factors which I told you, genetic susceptibility, and many these the acquired factors, diet, exercise related, these are some of the important factors which are responsible for this increasing burden of heart attack which we see.
Right, sir. Is there any trend in the young generation also? We already know that the older population is highly predisposed, but in the younger side, in the younger generation, are you seeing any increase in the cases of reporting heart attacks in younger generations?
Yes, we did analyze our data which I was talking about, which we have collected in last 5 years in Shimla districts particularly. We have seen almost 1500 patients of heart attack in last 5 years. So we found that people aged less than 40 years, I think it was 8%. Out of 100, 8 people are younger, less than 40. Okay. Youngest we have seen is 20 years old.
20 years old.
So young people getting heart attack, I think one of the reason is the smoking.
Right, sir.
Maybe the drug abuse, use of cocaine or maybe other addicting substances.
Right.
So I think we have to be very careful, especially the young people getting heart attack. Then you can well imagine they are throughout their life they have to be on medications. They are already basically disabled because of heart attack. Your heart becomes weaker. So they are not able to work also, physical activity also decreases. And they are always at a risk of, recurrence of heart attack and the deaths, premature deaths.
Right, sir. On that note, there's another beautiful number that they've composed. Can you please?
ऐसी उलझी नजर उनसे हटती नहीं, दांत से रेशमी डोर कटती नहीं, उम्र कब के बरस के सफेद हो गई, काली बदरी जवानी की घटती नहीं, बल्ला ये धड़कन बढ़ने लगी है, चेहरे की रंगत उड़ने लगी है, डर लगता है तन्हा सोने में जी, दिल तो बच्चा है जी, थोड़ा कच्चा है जी, दिल तो बच्चा है जी, थोड़ा कच्चा है जी.
So ladies and gentlemen, boys and girls, we have to be more cautious and more aware of heart disease and heart attack, and it can happen to any one of us. what are the warning signs for heart attack, and when it happens, what should be the things that people should watch for in order to determine that this is a heart attack, and so that they are able to reach the hospital in time, or they are able to give them some preliminary care to that kind of patient?
I think you have asked a very, very pertinent question, because people in general, they are not aware of the heart attack symptoms. With the result, they take long time to decide to go to the hospital.
Right, sir.
Because in heart attacks, there is a concept called golden hours.
Absolutely.
If you come within 1 hour, probably we can abort major damage to the heart. But by and large, what we have seen in our study, that almost people take 4 to 6 hours minimum. And there are people who come after 24 hours also.
Right, sir.
So therefore, it's very, very important that everybody should know what are the symptoms of heart attack, so that when they come across any person in the family, in the neighbors, in the any village or in the any community, they must guide the affected person to be taken to the nearest hospital where the facilities for diagnosis and treatment is available.
Right, sir.
So our aim should be to minimize the delay from symptoms to reporting in hospital. So coming on to the symptoms, the commonest symptoms is the chest pain. Chest pain, there are a number of other causes apart from heart attack, but the pain which basically characterizes the cardiac pain, heart pain, is basically the diffuse pain. It's not a localized pinpoint pain.
Right, sir.
Mostly seen in the chest, central part, but it can be on the left side, right side, or all over the chest. And the pain gradually increases in intensity, and within a few minutes it becomes very, very severe. And many times the pain radiates to the arms. It spreads to the arms, shoulders.
Either side,
to the
left
back,
or right arm?
Leg, both sides. It can mostly left side, sometimes it could be on the right. Many times both arms you experience the pain. And pain can also go to the shoulders, to the jaws, to the neck, sometimes to the back. Many times pain can be lower chest, lower part of the chest, and may be associated with, say, nausea, vomiting. Because of this pain location and vomiting and nausea, many people feel that this is related to gastric.
Right, sir.
So they tend to ignore the pain and reach hospital late. But this pain is, if it is associated with, say, for example, cold sweats, feeling of profound weakness, and if the person tries to get up and if he sees the blackout and falls down, these are reasonably quite specific signs or symptoms of heart attack.
Okay,
So
sir.
anyone with the chest pain, which may be spreading to the arms, and I told you the different sides, or maybe vomiting and cold sweats, or some people may have breathing difficulties,
Ji.
at rest or on minimal exertion. Without reason, suppose somebody feels breathless, tired easily,
Ji.
and some discomfort, make sure that these are heart attack symptoms and should not be ignored, irrespective of the time, whether it's a night or day. Aim should be to take the patient to the hospital at earliest.
Classical symptoms that are there, and with the advancement of medical technology and the diagnostic tools that are available, are there any other tests which can help us detect this event before it happens actually? What I'm trying to say is that can we know whether the person is predisposed to heart disease and is possibly a higher candidate for a heart attack than any other individual?
That's a very, very interesting question you have asked, because definitely there are prediction models.
Ji, sir.
We can predict the people who are at a high risk of heart attack in the future. So these are basically based on the 8 parameters: the age, the gender, the smoking, the diabetes status, level of blood pressure, level of cholesterol.
Right, sir.
So these are parameters which are basically fed into that calculator, risk calculator.
Okay, sir.
And these are based on the studies, not this is arbitrary,
Right,
the
right,
figures.
right.
So we can predict who is at a high risk of developing heart attacks. So we normally label person to be at high risk if his risk of developing heart attack or a stroke or death because of heart diseases
Ji.
in 10 years time is more than, say, 20%.
Ji.
That means this person is at a high risk,
High risk.
right? So therefore it boils down to the point again that the factor which leads to heart attack, these are the parameters which are taken into account.
Ji, sir.
So common man के लिए यही है कि one should be careful that he should know his or her level of blood pressure, cholesterol, sugar and blood pressure.
ठीक है sir.
and whether he is smoker or not. So based on that, we can calculate how high risk he or she is for
Sir,
developing.
perfect, sir. This is about high risk and this thing. But I was also trying to understand whether can this be prevented by doing a earlier test. For example, today we have the human genome decoded, and then we have the various proteins that get elevated before the heart attack happens, like the TROP-T or something like that. So, is there any other marker that can help us find out whether heart attack is going to happen?
The biomarker based, we do not have any specific genetic biomarker as of today that if it is there, you can say that he is at a very high risk. So, prediction models at present are based on the parameters which I described.
Right, sir.
But you know, we cannot advocate everybody to do a CT calcium scoring.
I see.
You know, sometimes you can do the calcium scoring.
Because they are costlier.
Costly, radiations is not feasible for screening in a population.
Right.
So first step is always based on these parameters which I told you. If you find somebody who is at a lower risk or intermediate risk, these prediction models are not also very 100% sensitive and specific.
G.
So therefore there is always a scope that the person who is labeled that he is at lower intermediate risk, he could in fact be at a higher risk.
G.
But prediction model has not identified
Right.
So for those there are certain markers, like somebody who is having some kind of autoimmune disorders, ladies with gestational diabetes, high blood pressure, and people who are obese, and all these factors generally are not taken into account in this prediction model. We look into those issues. These are called risk enhancers.
Right, sir.
Somebody with a low risk with risk enhancers, those are the patients where we ask for doing the calcium scoring in the CT scanning.
I see.
But we do not have specific biomarkers like blood test which can tell you that this person is at low risk or high risk.
What should be done if, for example, I get a heart attack right now, right here, or what the other person right next to me can do to help me survive?
So the first and foremost important thing, as I told you, that you should suspect that these symptoms are suggestive of heart attack. So the main thing should be that the person should be shifted to the hospital as early as possible.
Right, sir.
Reason behind this is that in the first hour, many patients they die suddenly because of sudden heart attack.
Sudden cardiac.
Following heart attack, some people develop abnormal heart rhythms, the fast heartbeat.
G.
And because of that, there is a sudden drop in blood pressure. This will compromise further blood supply to the heart as well as to the brain. If it is not reverted within few minutes, person can die suddenly. You must have heard somebody having some discomfort and he suddenly collapsed. Right. So this is a sudden cardiac death which is common in first hour. So therefore you should not waste time
and ignore the first hour.
And the patient should be taken to the nearest hospital immediately. But meantime, if you have, say for example, aspirin tablet available at home, because this is a readily available, many people may have it, and this is basically a blood thinner. And the heart attack is basically because of formation of clot in the artery.
Right, sir.
So if you give a blood thinner, it is likely that the clot can dissolve also before patient is shifted to the hospital. But you should not waste time looking for the aspirin. So the aim should be to shift the patient early
as soon as
possible and do not make the person to walk. Because walking will increase further stress on the heart.
Right.
He should be taken to on the stretcher or whatever means.
Right, sir.
And he should be reassured, because people are generally apprehensive. They have an inner feeling of doom. They fear they'll die because the pain is very intense.
Right.
So he should be reassured that everything will be all right. He will be taken to the hospital, and one should not delay. The caregivers or family members, whatever it is, they should not take time to shift the patient to a hospital.
Now looking at emergency and the urgency to shift the patient to the hospital immediately, preferably before 1 hour. What are the treatments that people do in the hospital so that people are aware of what all possible solutions are available for treatment? Most of our people in India especially, sir, we don't know what the doctor is doing. A lot of apprehensions are there in people's minds.
It's a very important question you have asked. Once we make a diagnosis that person is having heart attack,
yes,
depending upon the kind of hospital the patient is brought, there are two different forms of treatment which we give. Before that, I would just like to tell you that heart attack is basically because of sudden blockage of the blood flow to the heart,
Right, sir.
because of formation of clot on the diseased artery. So we have two forms of treatment. One, we give through drugs, which tries to dissolve that clot and restores the blood flow, which can be given at any setup,
Right, sir.
be it a primary health care center, community health center, civil hospitals, district hospital, as well as the medical colleges.
Correct,
Right.
correct.
But the other form of restoration of the blood flow is through the angioplasty, which general public knows this procedure in the name of
pretty
stenting,
Stent.
right?
Yes, sir.
So this is angioplasty, where we pass the guide wire, cross the blockage, and with the inflation of the balloon, that blocked portion is opened up.
Right, sir.
Then you put a stent, and the blood flow is restored. But that is the best option because it achieves the flow immediately. Because drugs many times may not be effective in dissolving the clot, depending upon how much is the delay
How much
after
the severity of
symptoms.
the
Because if you take longer period of time, the clot tends to organize, and the dissolution with the drug becomes less.
difficult.
So therefore, the restoration of blood flow may not be 100% in all patients. So, but that primary angioplasty is accessible only to the very small percentage of patients, because this is available only in the tertiary care centers.
Right, sir.
As I said, majority of the people live in the rural populations, and the benefit is maximum earlier you give it. If you wait for a person to be shifted from periphery and the remote areas to the medical college, taking hours time to shift, then do the procedure, the benefit is, the whole purpose is lost.
Right.
Because every minute counts. Because the longer you take time to open the artery, greater is the damage to the heart muscle.
I would like to bring in the aspect of technology here, because the logistics in Himachal is very difficult, and as you must be aware that even small kilometer distance takes a lot of time to reach, and especially in emergencies such as heart attack, where we need to be equipped in about 1 hour or so. How would the drone ambulances equipped with medicines for the heart attack fall out in this scenario in Himachal Pradesh?
You see, with the existing scenario, I would say that before we embark on the drone system,
Ji.
my feeling is that if we could strengthen the community health center, which are at this station at the block level,
Right, sir.
still people can reach block level hospital earlier than coming to the medical
main
college,
hospital.
right?
Right, sir.
Once we achieve that stage, every district, in every district, if the block level hospitals are equipped for diagnosis and giving this drug, this is better. But still we have long way to go.
Long way to go.
Right?
Right.
Except for Shimla district, rest of the districts we are trying to achieve this in the last 1 year or so. But still, I think there a lot of improvement needs to be done. But tomorrow, suppose if we achieve that the stage, our next steps should be to integrate the primary healthcare centers also, which are much more closer to the villages.
Right.
And at the PSC level, number of patients which you are likely to get, this kind of patient, it is going to be one or two in a year.
Right.
So to keep the stock of drugs which has a shelf life may not be cost effective.
Right, sir.
There comes, I think, the role of drone. So if you have a system to deliver the emergency medicine as and when required to the remote areas, remote PSCs, I think that is definitely warranted.
That way we can save the life-saving medication
Life-saving
also.
medications, use this drug more cost effectively, and reduce the traveling time by using the drone technology.
Right.
Because drone will deliver the medicine much faster than the people coming by road to the block level hospital.
थोड़ी थोड़ी तो सबकी सुनी, थोड़ा कुछ तो सबने कहा, थोड़ा थोड़ा समझा भी मगर दिल है कि माने कहा, बस इसकी जिद है दिल बेफिकर लापता, कैसी ये धुन है खोकर भी कुछ ना मिला, इस दिल की आदत यही है गिर कर संभलता नहीं है, जालिम समझता नहीं है ये कोई जुबान, ये दिल बेपरवाह, ये दिल बेपरवाह, ये दिल बेपरवाह.
Thank you, Vinod. What a lovely song.
दिल दियां गल्लां.
Sir, normally it is suggestive that healthy diet, exercise normally curtails the event of heart attack. Could you give our listeners and viewers a little bit idea which is practically feasible and easily be able to incorporate in their lives, especially the people in the corporates and who are running a very stressful lifestyle? Could you give us some hints on that?
Specifically, corporate people, mostly the time is a major constraint for them, as I understand.
Right.
So people generally tend to resort to ready to, cook kind of foods, pre-processed foods, right? These pre-processed foods are junk foods. These are basically rich in calories, but they are deficient in the various nutrients which are required to keep us healthy.
Right, sir.
Like trace elements, you have vitamins, we have antioxidants.
Right.
And these ready to cook eat meals are basically rich in salts and various preservatives, deficient in all these nutrients, essential nutrients, and therefore they tend to gain weight. And in corporate, because of lack of time, they do not exercise much.
Right.
So both ways, excessive caloric intake, poor quality food, lack of exercise, and
adding
stress,
to the risk factors.
stress of achieving target goals.
Right.
I think multiple factors are making them more prone for developing heart disease.
Sir, alcohol is good for the heart or bad for the heart?
This has always been asked. Actually, you see, we judge the evidence based on study designs, right? These, the perceptions that the alcohol is good for heart is based on the observational studies. And observational studies are subject to many biases. Until and unless we do some kind of intervention study where you use the alcohol and don't use the alcohol and see the effects,
Right.
that kind of study is ethically not acceptable.
Right, sir.
So this dilemma is always going to be there, but
I
by
see.
and large, people who consume one peg, 30 ml or so, probably may be beneficial based
Right,
on the observational studies.
So we
But
have to limit
limit.
the amount of alcohol.
Excessive alcohol is definitely important risk factors for many problems, for blood
Right.
pressure, for abnormal rhythm to the heart muscle disease, liver problems. It affects the brain functioning. So therefore, people who indulge in binge, the drinks
Drinking.
frequently, daily, I think these are the people who are likely to have trouble.
So in terms of antioxidants you just mentioned, sir, how about red wine in that case?
People give this an explanation that
Yes.
red wines probably are rich in antioxidants. That may be the reasons why the alcohol consumption in limited amount
Gee.
may be beneficial for the heart health. But we cannot recommend, but people who take alcohol, we advise them to limit. Take one drink a day and don't take excess of alcohol.
दिल दियां गल्लां.
What are the challenges in providing timely and effective care in a heart attack situation in Himachal Pradesh?
As I told you, in Himachal Pradesh, because of hilly terrain, the traveling time is more. People in general are not aware of symptoms of heart attack, and they take longer time to decide to go to the hospital.
Yeah.
Because many times they feel that this pain may be because of cervical spondylitis.
Right.
I told you it may be related to gastritis.
Gastritis.
So they think that it will get better.
Gee.
So in this, thinking, people generally take hours time to decide to shift to the hospital.
Which is
Secondly, I have seen that those who come directly to medical college, the patient level delay is much longer than people who go to the peripheral hospitals, the block level hospitals.
right, sir.
Because somebody has to come from far off village to the hospital and medical college, he has to arrange many other logistics. Probably that's the reason why they take longer time to
Right.
go.
Right, sir.
So therefore, I think the biggest challenge today to reduce the mortality or deaths because of heart attack is basically the long delay from symptoms to reaching hospital.
Absolutely.
And the hub and spoke model, which we are working on in Shimla district for last 5 years, is the model which to some extent gives addresses some of these challenges to reduce this time interval by strengthening the peripheral hospitals which are stationed at the block level, like civil hospital and community health centers, through teleconsultation services which we have started in whole of the Himachal Pradesh. And we advise them by helping them to interpret the ECG, which is a main diagnostic test used to diagnose that person is having heart attack and it requires that medicines.
Right.
So that has translated into significant reduction in the time delay and more use of these the drug, because the drug also has to be used in first 12 hours.
Right.
Earlier you use, better is the results.
Better the results.
But up to 12 years, the guidelines recommend that it should be used.
So one more thing I wanted to ask right here, sir, because we always say that time is very important and we have to get the treatment very as quick as possible. So if the treatment is not given on time, what are the fatalities that come with it?
As I told you, that if you do not open the blocked artery, the blood supply to the heart remains compromised for a certain period of time. The heart muscles are going to damage permanently.
Right.
As of today, we have no medicine to regenerate the heart muscles. So heart is left with a weak pumping action.
Right.
So which we call it as a heart failure.
Right. Sir.
So with the heart failure status, these patients are at a high risk of sudden death in future. And the premature deaths are quite high compared to people where we could salvage the heart, preserve the pumping function, and the long-term outcomes are much better here compared to the heart which have been damaged because of not receiving the emergency treatment timely.
It is possible to implant a new heart.
That is the last resort. You see, if heart is not working, then you change with the new heart, the cardiac transplantation. The biggest challenge in cardiac transplantation is that you need donor. You know, heart is one. So somebody with brain death, you know, registration, when do you get it? And the cost involved. So these are
so I think that problem might be solved by 3D printing of the heart, sir.
Probably your gene technology, genetic engineering technology probably can develop a new heart.
Right.
These are basically, they definitely optimistic, the options which in future may be there. But still, cardiac transplant is definitely one of the treatment options available, especially people with the severely damaged heart where they are not able to exercise at all and very weak heart. Transplant is definitely one option. And apart from transplant, we have these artificial hearts also. We can implant the artificial hearts, and many people live with the artificial heart also.
Sir, in Himachal, is there any case that
we Himachal, we have not reached to that stage of doing cardiac transplantation yet.
What advancements and initiatives in cardiac care are you excited about coming in Himachal? What do you think would really revolutionize the system in terms of cardiac care in Himachal Pradesh?
If you talk in terms of prevention of heart diseases, treatment of heart diseases, for prevention, I think in future, it's very, very important that we must strengthen the primary healthcare center, because the disease starts in the community. Some people are healthy, some people are diseased, at risk.
Right.
So why this disparity? This is basically, there's an individual to individual variation in the lifestyle which they have, even in the family member also.
Right.
So same environmental exposure, depending upon your level of understanding about what predisposes to heart diseases or any, for that matter, any disease, what precaution should I take? So that varies. By strengthening the primary healthcare services, particularly people who are working, health professionals who are working in the community, for example, ASHA workers, the health workers, multipurpose health workers, if we have strong team of these primary healthcare, frontline health workers so-called, and if they are empowered through training programs, educating people about adopting healthy lifestyle, and importance of periodic checkups every year after certain age groups, identify these high risk groups which I told you, 8 parameters which increase the risk which you can predict. Try to minimize, bring high risk into low risk. Probably then and only we can decrease, we can see the trends, declining trends of heart attack in times to come. This is one from the point of view of prevention. From the point of view of already patient having heart attack, for example, after heart failure, and there are new drugs have come up, And a lot of research is going on in the genetic engineering, biotechnology, molecular biology, trying to understand how the disease, the blockage develops in the arteries. So newer drugs are in the stage of investigations, development, and cholesterol is one of the important factor which produces the blockage. But we have now the interventions at the level of gene, where interfering the gene can lead to decreased synthesis of the cholesterol, and the effect will last for months together. Time will come when we will start have a gene editing, where we correct the defective gene, lower the cholesterol level, and then there is no question of taking medicine daily. Today we have to take daily.
Yes, sir.
Yeah, these molecules,
condition.
right? So we take daily. So therefore the compliance becomes a major issue. Affordability becomes major issue. Availability becomes a major issue. Periodic reporting to hospital becomes major issues. So there are number of challenges which basically, in spite of the fact we know what causes, how we can prevent, but implementing these strategies would be is a major challenge. So but if we can develop that kind of science progresses to that extent, by genetic manipulations we address the risk, and then you don't have to take probably that
Sir, I think that is already being done in lower species.
I think the research is going on in a very rapid pace. I think new technology, you know better probably, molecular technologies, the gene expressions, epigenetic phenomena, various, the lifestyle, the so-called acquired risk factor can influence the gene expression. So previously people used to think that if you inherit a bad gene, you are likely to develop. But you can still prevent through these epigenetic mechanisms, where expression of the genes can be regulated still.
Right, sir.
So I think future is very bright, but in our generation whether we'll see that breakthrough, that's a big question.
That is a good. As we wrap up, sir, the most important message you want to give to the people of Himachal for heart care and prevention of heart attacks, sir?
So I think based on what we know today and what is the prevailing situations, I would say that I would basically advise everybody that we should know what to eat, how much to eat, what not to eat, and importance of daily exercise in everybody's routine. Like we eat meals, we do brush, we take bath. Same way that physical activity should also be part of your routine.
Right.
Everybody must exercise at least for 1 hour daily. Make sure the weight is optimum. Should stay away from these tobacco consumption and other drugs. And do periodic monitoring, because many times in spite of doing all these things, still some people are predisposed to develop high blood pressure because of many reasons which we have no control. And some may develop diabetes, some may develop high cholesterol. So until unless you do periodic checkups, you will not know whether these biological parameters are within control range or not. So if you do that and take a precaution through diet, through exercise, through medications, as advised by your treating doctors, if everybody practices this, I am sure in the next 5-10 years time you will find that number of heart attack which we see today,
is already,
as I told
on
you, 70 people get heart attack every year out of 1 lakh population. We will reduce
that further. We have one song waiting for you from our lovely band here.
दिल है कि मानता नहीं, दिल है कि मानता नहीं, ये बेकरारी क्यों हो रही है, ये जानता ही नहीं। ओ दिल है कि मानता नहीं, दिल तो ये चाहे हर पल तुम्हें हम बस यूं ही देखा करे, मर के भी तुमसे हम ना जुदा हों, आओ कुछ ऐसा करे, मुझ में समा जा पास आ जा, हमदम मेरे हमनशी। ओ दिल है कि मानता नहीं, ओ दिल है कि मानता नहीं।
Thank you, gentlemen. Thank you for listening and have a good time.